Sometimes life's burdens can take their toll on your emotional well-being. If you or a loved one is struggling, know that you are not alone. South Texas Health System Behavioral can help you cope with depression, manage feelings of anxiety, regain control of mood swings, and recover from substance use disorders. Our staff is available 24/7, offering the quality and compassionate inpatient and outpatient care you need to overcome life's challenges. South Texas Health System Behavioral, where your mental health is our priority. Greetings and welcome to our latest Let's Talk Mental Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. On behalf of the STHS Behavioral team, thank you for joining us. It should come as little surprise, neglecting your mental health can lead to serious consequences, including chronic physical illness, poor relationships, and a reduced ability to work or engage socially. Good mental health, on the other hand, enables you to manage stress, navigate challenges, foster positive connections, and build resilience, which all helps you lead a fulfilling and meaningful life. So to help Rio Grande Valley residents get their mental health in check, STHS Behavioral hosts these monthly Let's Talk Mental Health webinars. By highlighting common mental health issues and offering strategies for good mental health, we hope to break the stigma surrounding mental health and inspire more people to open up about their own struggles and get professional help if needed. In this installment, we'll be discussing trauma and its impact on mental health. When a person experiences a traumatic event, the brain releases stress hormones that activate the body's fight or flight response, which can lead to changes in brain structure and function. The changes can result in long-term effects. Unfortunately, trauma is widespread, with around 70% of U.S. adults experiencing at least one traumatic event in their lifetime per the CDC. And it significantly increases the risk of mental issues, including post-traumatic stress disorder, depression, and anxiety disorders. So to learn more about the connection between trauma and mental health, we're joined by Bob Cooper, a licensed clinical social worker supervisor who serves as the Director of Utilization Review at STHS Behavioral. Bob, thank you so much for joining us.
Thank you for having me, Tom.
Now, you are always one of our favorite guests because you have such a wealth of knowledge when it comes to mental health, and you have so many vast experiences, both private and in the hospital setting as well when it comes to mental health.
Right. I've worked in the hospital as a social worker on units before, plus I do outpatient therapy as well. So you learn a whole lot about trauma as you go through.
And when it comes to trauma, that 70% number, does that surprise you that that number is that high?
No, actually it's a little low, because when you think about it, when you lose a parent, when a parent dies, that's going to be traumatic for you, and just about everybody through their lifespan is going to lose a parent, maybe a sibling. So there are a whole lot of things that happen to us that can be traumatic based on how you experience it.
And when it comes to trauma and dealing with it, do you see in the hospital setting the result of people not taking care of that trauma immediately, and sort of it festers and then it leads to these issues that may result in hospitalization?
Well, what happens is that our response to trauma changes the way that we interact with other people. It changes the way that we view the world. When you think about it, a very, very small child thinks of the world as just a happy place. It's a place that doesn't feel harmful. It's a place of wonder. And then once trauma happens, no matter how small, it changes the way you see the world. And over time, based on the trauma that you've experienced, the world can look really dangerous. Mm-hmm. And so if you don't necessarily have to take care of all trauma right away, but it changes the way that we respond to different things. And over time, it's kind of like being shaped by sandpaper. Each time we experience a trauma, and it changes who we are, how we see the world, and how we behave.
Mm-hmm. And in your private practice, what percentage of your patients would you say are dealing with some type of trauma, maybe from their childhood or obviously later in life, that is resulting in them needing some additional mental health services?
In my private practice, I only see adults, and most of them have experienced a trauma, but most of them that I see in my clinic aren't there for trauma. Mm-hmm. They're there for other things. They're there for some anxiety or some depression that may have some light roots in their trauma, but most of them are not there to resolve the trauma. Mm-hmm. Now, I do have several people who have been hurt badly, and it has changed them completely, and that's what we're trying to resolve in therapy.
And when it comes to learning about what we need to know when it comes to trauma, education is key. You have a great presentation for us, so let's get started.
Okay, thank you. So, trauma is an emotional response to a terrible event, an accident, abuse, death, an injury. Usually it's something that has threatened your integrity, whether you actually experience the trauma yourself or if you're just a witness. Sometimes the trauma is being close to an event that happens. I see a woman who was in a car accident. She wasn't the driver, but she was afraid enough that it changed the way that she sees things. Initially, we really saw trauma in the lens of the military. Back in the old days, there was a term called shell shock from World War I. And that is how they explained the changes in behavior for the soldiers who were coming home from battle. And they saw a lot of isolation, a lot of withdrawal. And they really couldn't talk about it very well because people didn't understand their experience. And this is a fairly common theme across trauma treatment. You don't understand what I went through. Our trauma is very individualized. Trauma has been more widely defined. There are some people that will talk about microaggressions that are very small things that most people would overlook, but occasionally somebody can become offended in such a way that they see it as a small psychological trauma. We've expanded the definition to include psychological abuse and neglect. Sometimes people who do sports that have injuries over time, each one of those is seen as a trauma. Then we also see results of physical trauma as well. But trauma is relative. My trauma is not your trauma. And when I was a teenager, we lost my father. I was very young, and each one of my siblings experienced it in a very different way. We all lost our father, but our experience and how it shaped us changed. Okay, so there are three basic kinds of trauma. Acute trauma is when something happens and we are affected by it. Think about a car accident. It changes the way that you see the road, the way you see other drivers, the way you see yourself. It's a one-time thing. It can cause serious problems. Chronic trauma happens when an event is repeated over time. Think about a woman who is being abused by her husband. And each time it just complicates that trauma and builds on it and builds on it and builds on it. Complicated trauma, on the other hand, is when you experience different types of trauma over a span of time. So you take the poor woman who's being abused by her husband, put her in a car accident, have her lose her mother and lose some of the supports around her. And now her trauma is coming at her from all different sides. And it takes different treatment planning based on the type of trauma and your response to it. So like any other mental health concern, when do you have to seek help for trauma? When it's causing problems. And a lot of times we're aware of it. I've treated several people for fear of driving because they were involved in something on the road and they felt like they couldn't drive anymore. That's kind of obvious. Sometimes you don't see it right away. I have a lady in treatment right now who doesn't like to go to Walmart. She doesn't like to go to the mall. She doesn't like to go where there are a lot of people. And a lot of that has to do with traumatic experience that she had when she was younger. It changed the way that she sees the world. The world is now a dangerous place to her. And so she stays home a lot. And that's what we're working on, is getting her out of her home and back out in the world. So there are a lot of people that will tell you, well, you have to talk about the trauma. We have to talk about it. We have to go into great detail. We have to examine all aspects and facets of your trauma. That's just not true all of the time. For some people, talking about their trauma will make things worse. We develop in our own way a kind of protective way about us, where we try and compartmentalize things and we deal with things in our own way. And so if you seek therapy for trauma and they insist on you talking about all details of your trauma, it should come with a trigger warning. your flashbacks, your nightmares can get worse talking about this. And sometimes you really don't need to talk about it right now. When I first meet a client for the very first time and we sit down for an assessment, trauma is something that we have to ask about. There's about 20 things in an assessment that have to be covered in the hour or so that you have. And I warn them though, this is your time, and it's your treatment, and it's your therapy. We talk about as much as you want or as little as you want. That's entirely up to you. I'm working for you as your therapist. When we get to the trauma portion, all I really need to know off the top are the broad strokes. What kind of things have happened? Any details beyond that really aren't necessary during an assessment, because we really don't have the time to stabilize and shore up their defenses, and we don't want things to get worse. We want them to stay engaged in treatment, and so we're not going to force things. So, as I said, for some people, it makes things worse. They talk about their trauma in great detail, and nightmares that have receded a little bit over time, much worse now, much more intrusive, much more frequent. And they have flashbacks. And the lady I was talking about before that has a whole lot of serious trauma in her past, we just recently had a very, very nice session where she recognized the difference between flashbacks and memories for the first time. A memory is something that I remember, and she can remember some of her trauma. In a flashback, she feels like she's in the middle of it and reliving it. They're very, very different. A flashback is re-traumatizing. It's hard to get out of, and it's really, really disturbing. A memory, on the other hand, is just something that I remember. And so over time, we've been able to reduce the frequency and the intensity of her flashbacks. But we've had to be very careful about this because it's her treatment, and we want to make sure that she's comfortable. Not all therapy is comfortable, let's be honest. Sometimes you do have to talk about things that you really don't want to talk about. But we have to do it at your pace, not mine. Sometimes talking about these things is healthy because you're admitting, you know what? This is who I am because this is where I've been. I understand that I have changed over time because I've been traumatized. But at the same time, this is very important. We'll talk about this more in a minute. I'm not my trauma. So one of the things that a social worker, a clinical social worker like me, is supposed to do, and this is true of all therapists, is you're supposed to go to where the client is. We don't bring the client to us. We don't take them down a path they don't want to go. Like I said, I work for you. It's your time. It's your treatment plan. We need to go at your pace. We really need to work on what you feel comfortable doing. Because if you're not comfortable, you're not going to come back. And if you don't come back to therapy now, you may quit therapy altogether. It's okay to leave your therapist if you're not comfortable, but don't quit therapy. Find somebody else that you feel can help you. So a therapist that tells you what you have to do in therapy, you must do this. This is what we have to work on. This is what we need to do. Might not be a good match for you because it's your problem. You're the one that came to the office looking for help. What I'm supposed to do as your therapist is to help you to help yourself. I can't tell you what to do and I can't tell you what to choose. We can only look and see what's possible and what might be best for you. In the end, it's your choice. So I'm sitting in an assessment and my client is getting really uncomfortable. She's decided, okay, I can talk about this. But as she starts talking through her trauma, she starts to fall apart a little bit. So I asked her, do you know where I can get a good taco? I haven't really found one since I've been down here. Who's got a really good taco? And she's taken aback by it for a second, but it's food. And everybody knows food, and everybody in the valley knows tacos. Occasionally I'll ask about hamburgers, but definitely tacos. And we talk for 3 or 4 minutes about who's got a good taco, whose taco really isn't that good, who's overrated, who you tried, who you haven't tried, what's your mom like? And then, as she regains her composure, I lean in and I ask her, you know why we're talking about tacos, don't you? And she gives me a little sheepish smile. She said, yes, I know. Okay. Got you composed now and you feel better. Do you want to pick up where you left off? Or do you want to pursue something else? It's your choice. Oftentimes, they've recovered themselves to the point where, okay, I can talk about this. We're not diminishing their trauma at all. We're not trivializing it or anything else. This is who they are in their real experience. We're just giving them a slight distraction to kind of pull things together and feel more comfortable. That's all. And once they feel comfortable, they choose the path to go down next time. So, why do you want to talk about your trauma? Because you need support. And although other people don't know your true trauma experience, and they haven't gone through exactly the same thing that you have, they've gone through similar things. And they can offer self-help. Here's what worked for me. It might help you, it might not. But I'm trying to give you some hope here. I've gotten better from my trauma, and hopefully I can help you with yours. It can reduce isolation and give you a bigger sense of community. It's much easier when you realize that I'm not alone in this. Other people have gone through these problems as well. There are support groups out there. There's a lot of online groups about this. And some of my clients have said they get a lot of help with self-help groups. You also want to talk because you're trying to make sense about what happened. Because trauma is completely senseless. Sometimes you're just in the wrong time, at the wrong place, and you're just unlucky. Sometimes you run across somebody that's just awful, and you just happen to be there. One thing that you need to generally realize is that the trauma was never about you. It wasn't personal. If you hadn't been present, if you had been in a different place, the perpetrator would have hurt somebody else. You just happened to be there. It's bad luck. It's not because they hate you personally. You were just there. You were a target of opportunity. Oftentimes that's all it is. But we personalize that, right? Especially as children. Why me? Why not my brother? Why not my sister? Why me? And we get lost in that. We get confused, and we don't understand why somebody would treat me that way and not somebody else. It's a senseless thing, but talking about it hopefully can find some sense to it. You also need to talk about this, about your identity. And this is where trauma gets truly, truly complicated, in my opinion. It's really easy when you're re-traumatized to become a victim, and that's who I am. I've talked about here before, I asked people during the assessment, who are you? And people with complicated trauma oftentimes don't feel it on the surface, but underneath they feel they are truly a victim. That's who I am. And it's really difficult to change that mindset. Once we decide who we are, it can be difficult to turn that around. We did really well with that with cancer. We don't talk about cancer victims anymore. We talk about cancer survivors. The same thing is true of trauma. What's more important than understanding truly what happened is how you survived it. You've lived through some awful things. And so some of the problems that we have today, relative to the things we survived, much easier to deal with. We have to understand that we got through some pretty difficult crises before. And if I can survive those things, I can survive darn near everything. Your trauma shapes you, but again, it's not who you are. One of the problems with developing a victim identity is that if you no longer have a perpetrator and you can't be a victim, you'll put yourselves in situations where you can be a victim. And if you don't have a true perpetrator, some trauma victims perpetrate on themselves. Non-suicidal self-injury, they cut themselves or burn themselves on purpose. Or they put themselves in situations, risky situations, because I'm a victim and that's what's going to happen to me. We also want to talk because we need to ground ourselves and we need to test our reality. Am I having a flashback or am I having a memory? And so one of the things that you can do if you're truly having a flashback, or you start to have a flashback and you recognize that you're having a hard time, is to have some sort of sensory distraction. The lady I was talking about before, I told her, keep a bag of frozen peas in your freezer. And when you start to feel a little bit off kilter, grab those peas. And that kind of sensory shock of the cold peas, it's a sensory distraction and it can head things off. You can do those things with, one of the little jarred candles. Some sort of sensory distraction can head things off. You also have to realize that you are not responsible for your abuse. When you're in kindergarten, did anybody ask you if you want to grow up to be an abuse victim? No. Most of the time, it's bad fortune. It truly is. And no one hit you because of who you are. They hit you because of who they are. And that's a very important distinction. It was never about you. It was always about them. You also want to talk to move forward. You want to get your life back because a lot of people who are trauma victims feel like they've lost something. I can't do this or I can't do that. Or I feel this way, I feel that way. And it's become problematic to the point that I need to get my life back and I need to feel like I have a sense of control. In the middle of trauma, you have no control. And worst of all, you know you have no control. And so if you see somebody that has things like OCD behaviors where everything has to be in its exact place and everything is completely organized, everything down to a T, odds are pretty good they've experienced some sort of trauma in their life that's made them crave control. So, questions about your therapist, because we want you to get the help that you need. Am I being heard? Is my therapist listening to me or are they driving the conversation? If you don't feel heard, you're probably in the wrong place. Am I feeling any better? So at the end of an assessment, I'll ask my client, was this worth your time? Most of the time they say yes, but not every time. And I dread the time when they say, no, I don't really think I got much out of this. But it happens. Sometimes you and your therapist are not a good fit. Am I guiding my treatment or is my therapist guiding my treatment? I've run into problems before where I've worked with trauma victims who want to be told what to do. And I can't do that. It's not my place. I have to live with my choices, and my clients have to live with theirs. I can offer them options, but in the end, they have to make that choice. Do I trust my treatment team? Do I feel like they're giving out my information? Are they talking about me? Are they honest? Are they really listening? You know, there's a lot of things about electronic medical records these days. And I've worked with them before. I work with one now. I take notes and write my notes later. But some people type as you talk. It's a matter of whether you feel comfortable with that or not. And it's something that you need to talk to your therapist about because you have to feel like you belong in the office. Can I talk freely? If you're worried too much about what your therapist thinks about you, you're probably in the wrong place. They're supposed to be non-judgmental. They're supposed to show you unconditional positive regard, regardless of why you're there. And if you don't feel comfortable talking to them, you're probably in the wrong place. You may feel uncomfortable talking about specific events, and that's okay. Maybe we get there, maybe we don't. But if you feel uncomfortable in general, if you really don't want to go to therapy, if you're dreading your appointment, you may want to reevaluate your therapist. You can get help from different places. Can I go to some sort of self-help group and not see a therapist at all? Maybe. Can I see my pastor instead of a therapist? Possibly. Do I need to see a professional? Okay. If you do see a professional, you want to see somebody that's independently licensed. There are certifications out there for trauma treatment. You may be interested in looking into that, but it's kind of like heart surgery. You know, you don't have to have that kind of, you don't have to experience that same kind of thing to provide treatment for it. You kind of need to have somebody that you want to go see so that you feel like you're getting better. You want somebody who's in your network if you have insurance, absolutely. I always say the first call should be to your insurance company. Find out who's in your network. Because therapy is really expensive for people who don't have insurance. It's super expensive if you're paying somebody out of network. I have told clients of mine who I had a good relationship with, when their insurance changed at work, you need to see somebody else. I'm really, really good. I'm not that good. You have to pay attention to your copays. One of my clients is coming back to treatment this weekend. I haven't seen her in several months because she couldn't afford the copays, and my contract doesn't allow me to waive those, unfortunately. There are places where you can get reduced fee help. There are places, some places you can even get free services. You have to explore that though. You want to see a therapist who's available. In the beginning, you might feel really, really uncomfortable with the life that you're having right now. That's what got you into therapy. And you want somebody who's going to be available to see you on a schedule that you feel like you need. Now, I inherited a couple of patients, I don't know, about a year and a half ago from a therapist who retired. They fired me right away because I wouldn't see them every week. But talking about them about their problems, I didn't really feel like it was necessary. They just wanted somebody to talk to more than they wanted therapy. That's not what we're here for. And finally, you want to go somewhere that has the services that you need. If you came to see me in the clinic, you'd be seeing me for therapy, and that's it. Sometimes you might want to go someplace where they have therapists and physicians who can prescribe medications and things like that and have more integrated care. It depends on what you need and what you want to work for. And so for your first appointment, get there early. There will be paperwork. Make sure that you bring an ID and your insurance card and your medication list. I'm not surprised anymore, but I was for a while about how many people took several medications and didn't know the names of them. I take a blood pressure pill, I don't know what it is. You know, and that's a common response. I'm a therapist, I'm not a physician. I'm not going to prescribe anything, but I probably need to know just so that to make sure that you're getting the care that you need. I recently saw somebody who had come out of the hospital, had been home for a few months, and then came into therapy and said, I haven't seen my psychiatrist since I got out of the hospital. That's probably not very good, and I need to know that so I can try and get you an appointment and get you back into care. And finally, come to therapy with hope. There are a lot of good therapists out there. There are some bad therapists out there, I'll be honest with you. And there's some that just aren't going to be a good match for you. That's okay. But be hopeful when you come in. Be hopeful. You have limits as to what you're willing to tell, and that's okay. You have limits as to how much time and what days you're available. That's okay. We'll talk about it. You'll tell me a story, and we'll see what's next. Thanks. Tom?
Thank you. That's great information. Now let's talk a little bit about how our bodies respond to danger. So
Yes.
the trauma, and we talk about that flight or fight mode, but there's more than just that. There's freeze.
Yes.
So
And
describe
fawn.
that. And then there's flop or fawn.
Yes.
Yes?
Yes.
Tell us a little bit about the difference when, just so that people are aware, like how they may react. So
Okay.
freeze.
So, well, a lot of people don't understand that anxiety is necessary. It's what protects us. It's what keeps us alive. When some joker cuts you off on the freeway, that's your anxiety that helps you swerve out of the way and not get hit. And so there's the middle part of your brain, the lizard part, has kind of like this gate in it. Okay. And so when you recognize threat, it pops open. And there's blood floods to your big muscles and all these other things, and you are focused and in the very millisecond.
Mm-hmm.
And what you're supposed to do is you behave in some way to resolve that threat, and then it closes back up, but it's always scanning for threats.
Yes.
Okay. So you talk about fight, flight. Freeze is literally that. I don't do anything, right? And occasionally, you see that happen. You see that happen a lot with kids who live in abusive households.
Okay.
Right? They will see their father attack their mother or something like that, and they freeze and don't do anything. That is not an uncommon or unnatural response, because they are experiencing vicarious trauma. They're seeing something happen, and they just can't do anything. They just lock up.
Okay.
It is a response to terror or horror. That's what that is. Fawning, on the other hand, happens when sometimes we are overly accommodating to our attacker.
Okay.
You will see, and this happens a lot in domestic violence, where we ask from the outside, why does she stay? Why does she stay? And there are a whole lot of different reasons, but that kind of a response where she is caring for her attacker. And there are a lot of stories about the police coming and the victim attacking the police. That's that kind of a thing. That's the fawn response.
Okay. And then obviously you have the flight. You just run away.
I got to go. See ya.
And
So
then-
long. I'm out of here.
And then
Yes.
fight.
Yes.
So
Really, the fight response, not as common, but it does happen. And we have to, unfortunately, we're in the world of active shooters now. And we do training on all those kinds of things. And fight should be your last response. Your first response should be to flee and get to safety and everything else. But there are people who will go and fight. One of the common things that they used to show in war movies, a grenade gets thrown in and somebody jumps on it. That's a fight response, right? So there you go.
And can you experience different types of response depending on the situation?
Absolutely.
So-
Absolutely. Trauma is very individualized. And there are sometimes we will see people that will go to pieces or something like that over something that we feel is just very, very small and trivial. But we don't know what their trauma history is and the reasons why they respond this way.
And when it comes to how trauma makes us feel, we can experience so many different feelings, everything from anger, numbness, grief, scared or panicked, irritable, confused, restless. It's okay to have those feelings, those big feelings, right?
Absolutely. And especially because by and large, not always, but by and large, trauma is unexpected. And so we can't process in that immediate moment necessarily how to respond to this. A lot of this is retroactive. We look back and we see how did we respond and everything else, and we can process that and maybe be prepared a little bit better. But a lot of times we're looking back on how I felt. Was my feeling appropriate? Because sometimes it's not. Was my action appropriate? Sometimes it's not. And so we trying to understand and gain insight into what happened and what caused us to respond this way.
Now, one of the things that you sort of touched on in the presentation was self-blame, where especially I would think if somebody froze in the moment or fled and left others behind, you may have those feelings of self-blame and guilt. How do you process that? How do you recommend dealing with that self-blame?
Some of that has to do with what you should have done in the first place. And sometimes fleeing is the right response, and that the other people who stayed in that kind of a situation, you know, just didn't respond in the same way, but you were seeking safety. And that's what we're supposed to do at all points, is seek safety. We don't always do that, but that's generally what we're supposed to do. We have to protect ourselves at all costs. That's what life's about. But, you know, sometimes you have like survivor's guilt, you know, where there's a big bus accident, 20-something people died, but you weren't one of them. And so we have responses like that, and we have to look and see about what our role was and how we responded to the situation and everything else. That kind of thing is easier to deal with than if you left somebody, say, we have a lot of problems with young men whose mother was abused in front of them, and they felt like they were unable to do anything against the attacker and everything else. There's a lot of blame in that kind of situation. The other part about parental abuse that we see a lot of blame is, it was something about me that made my mother do this or made my father do this. And it wasn't. It was about them. It was their choice. It was their behavior. You just happened to be there. And they will do what they need to do to justify it. There's a whole lot of that white hat thing that we have to address when people dismiss their behaviors because they have to be the hero.
And when it comes to trauma, it can affect you physically as well. Obviously, you're dealing with feelings and emotions, but it can also impact your health.
It can impact your sleep, your ability to eat. It can also make you more prone to having chronic health problems. You're more likely to have heart disease and heart attacks. It can make you more liable to have a stroke later in life. It can also lead to negative behaviors. Smoking, drug and alcohol use can be linked to trauma as a way to try and escape those kind of feelings and everything else. So it can have long-term negative effects like that as well.
And you talked a little bit about the experiences that you might have after trauma. You talked about nightmares, flashbacks, but we also, unfortunately, there is the threat of self-harm.
Yes.
Suicidal ideation.
Yes.
Those issues. So when a person starts to get that feeling of wanting to harm themselves, it's really important to seek help.
Yes, absolutely. And one of the things that you can see, and I mentioned this at the very end, is that somebody who's develops that victim mentality can cut themselves because I'm not worth anything because I've experienced this trauma before. And so other people that harm themselves like that have just a numbing response to previous trauma, and now they're just trying to feel something because feeling bad is better than not feeling anything at all. And so you have a lot of people who, as they transition from childhood, adolescent abuse, why would a mother do that to the child? I must not be worth anything because she's supposed to protect me and she's hurting me. And so they get this kind of negative self-image that I must be worthless if my mother wouldn't take care of me. And so there are a whole lot of complicated things in there. And untying a whole lot of these knots is really, really difficult and takes a lot of time.
And when you're dealing with trauma, it's really important to avoid taking substances because substance use disorder can become an issue. It becomes your crutch to numb yourself from pain that you may be feeling or not deal with emotions?
It's not exactly a crutch, but what generally happens, in my experience, is that when we experience a problem, we try and deal with it. That's what coping is. We try and deal with it. And we try different things. And oftentimes, something will work, or it appears to work. So imagine this. You're having a whole lot of stress because of family problems. I got drunk and I didn't feel it. Just for a little while, I didn't feel it. And that little experience is really powerful. And so when you have problems again in the future, I'm going to go back to that thing that helped me before. It didn't really help, but by gosh, it took that feeling away for a while. And over time, that can develop into a serious problem, right? And so unlearning negative coping skills is really, really difficult because oftentimes it only comes with a price. You can make short-term changes but making long-term change, usually there has to be a consequence big enough for you to really invest in that change.
Now, when does trauma become PTSD?
Trauma is just something that happens. PTSD is a psychiatric diagnosis that has 3 or 4 hallmarks, and you have to meet certain criteria to actually be diagnosed with PTSD. And so nightmares is one of those, flashbacks another, disassociation where you feel like you're out of body and you just don't feel like things that are going on around you are real. And there's also avoidance of things that would remind you of that. So like some of the people I was talking about that won't drive because they experienced a trauma in a car or something like that before, that's avoidance. And so when you put those things together over a certain amount of time with a certain amount of impairment, that's where you get PTSD. It's kind of, you know, it started out with the military. There are other trauma-related disorders that may not meet the full criteria of PTSD, but trauma is the source of the problem. And so you treat that very similarly.
Now, how can childhood trauma affect you into adulthood?
It develops the way, it changes the way you see the world. And so if, you know, we start, and generally in our lives we see how babies are nurtured and everything else, and oh, the baby's the middle of the world and everything else, and the whole world revolves around the baby. Over time, babies like kittens get older and they get a little more frustrating and everything else, and people will abuse babies. It's an awful thing, but it happens. And so the baby goes from feeling like the world is a safe place and everybody around me loves me to the world is a dangerous place and I don't trust anybody and I don't develop good relationships because I'm waiting for you to hurt me just like everybody else has. And so these kinds of things, and there are a whole lot of other trauma responses you can develop, change the way that we behave and how the way we interact with other people. And that's where the real problems are. You'll see people who are abused by men, girls, women, boys, doesn't matter. They develop suspicious and untrusting relationships with men for the rest of their lives unless they seek help, because that's what I know. And so trauma is very much, this is what happened to me, this is something I know. And so undoing that, it can be very difficult.
Can witnessing traumatic events happening around the world, we hear a lot about gun violence, we had COVID that people were dealing with for 3 years, 3 to 5 years, can those over time impact us and lead to trauma?
Absolutely. Those kind of things are called vicarious trauma. It's when something happens to somebody close to us. We don't experience it, but it happens to somebody close to us or we witness that. And so generally, it's when we feel there's some sort of threat to our integrity, where we are either going to be badly hurt or we're going to die from this. And so we can witness those kinds of things and be traumatized. And what can be very, very difficult is seeing somebody who witnesses something and we go, I saw it and it wasn't a problem. Our resiliency, like our trauma, is very, very different. And there are some people that can be very easily traumatized over seemingly nothing. But it's based on their history and their response. So yes, there are people that can get very, very traumatized by watching television. I had a patient who actually turned out to be somewhat prescient several years ago. One of the things that brought her into treatment was the war in Ukraine when it first started. She said the world's going to end over this.
Yes.
And it was nothing at the time, really, but look what it's grown into and all the different repercussions of it. But when it first started, that was her response, just seeing that on television.
I remember growing up, HBO had this special on Nostradamus, and it had all these predictions that were happening, and it was really scary to think about World War III would be happening at some point, and knowing that you're growing up in this, and when is this shoe going to drop? So the war in Ukraine probably it was her moment of, she probably saw the same special.
And it's a generational thing as well. You know, we were young in the Cold War and everything else, and we were afraid of what happens when the nukes start flying.
Yeah.
You know, you don't hear about that as much anymore, but you know, when I was younger, you heard about that quite a bit, and how many times each country could destroy the world over, and all of these other things. It's a generational difference. But yeah.
Now, when it comes to coping with trauma, there's a lot of advice. Obviously, one of the key things is to keep yourself safe. So making sure that you're in a safe space and able to deal with that trauma.
And you are going to have to eventually talk to somebody about it. It's just how much help you need and everything else, and what kind of problem is it causing. It's very difficult sometimes to be attentive to what we're doing, and be able to explain why I am this way and why I react this way, because sometimes it's far enough in the past that we don't recognize that anymore, and we've compartmentalized it enough that we've kind of put it in a box somewhere and try not to think about it. And so that lack of attention sometimes can just let things fester.
Which leads to the next point. Prioritize what you decide to do now and what can wait.
Right. So the lady with the Ukraine thing, it's a half a world away, and there's not much that you can do about it. You know, it can worry you and everything else, but here in South Texas, what are you going to change about that? And that's one of the things that we have to be attentive to, is what are the things that I have agency over, that I have some control over. And I need to focus on those things, and I need to try and let go a little bit of the things that I just can't change.
Feel your emotions, and I think that is something, especially in the Latino culture, we're brought up not to show emotion, to be strong, but you have to get the feels, right?
Right, but at the same time, you also have to examine your emotions, because our emotions are choices. We choose how we feel. And one of the things that you hear quite a bit in therapy, my mom makes me feel angry. No, your mom acts a certain way, you choose to be angry about it. And so sometimes most times our emotions are appropriate. Sometimes they're not. Sometimes our emotions are out of whack. And so we can, due to previous trauma, we can feel sad and depressed in a situation where maybe we should feel angry, because we've put this kind of self-blame on ourselves, or we're trying to change the way that we feel about the person that's irritating. So we have to examine what our emotions are, and whether we're truly choosing those emotions or not, because sometimes we can choose not to feel that way.
Now, sometimes we may have some really difficult feelings that we're dealing with trauma, and flashbacks and nightmares are things that are not necessarily things that you can control. What advice do you have for dealing with a flashback or nightmares that somebody may be dealing with?
Some of that, like I said, you need some sensory distraction for flashbacks. Nightmares, that's not going to help very much. But you can practice some mindfulness techniques, and that's something that you can learn in therapy, that can help rewire some of that negative brain energy, and put you in a space where you feel better about where I am now. Many years ago, when I was a hospital social worker in a psychiatric unit, most of the women who were admitted to the adult unit wanted more than anything else in the whole world to be unabused. You can't do that.
Yeah.
You can't take that away. It's not who you are, but it has shaped how you got to this point in your life. And so what we need to do is learn how to live with that better, and not make ourselves a victim of our past, but make ourselves a survivor of it.
Now, when it comes to helping yourself long term, why is it so important to know your triggers?
You had to say
triggers, that as an easy
you?
question, but
it's not an easy question.
Yeah.
And this is something that personally I think is overwrought quite a bit. The world does not come with a trigger warning, and so we are going to run across things in our life that we're not comfortable with or that we may not want to face. We're going to have to be able to face those things, though. I worked with a therapist many years ago who did not want to work with a substance abuser, any way, shape, or form. And so she worked mostly with kids, but when she would have to work with the parents, she said, well, do you all use drugs? And the parents said, well, you know, I tried marijuana in high school. Send them for a substance abuse assessment. I don't want anything to do with it, right? You can't work that way because you're going to run across these things. You're going to run across people who have been victimized with abuse. You're going to run across all of these things in your life. You probably are going to witness a crime in your life, whether you want to or not. You're going to witness accidents and everything else. We don't live in a bubble. We're not surrounded with plastic wrap, and we can't really try and be that way. The world is what the world is, and we have to find our place in it. And we have to seek some sort of positivity about it. Not happiness, positivity, so that we can live the life that we have. Life is precious because it's limited. And so we have to find a way around some of our fears and everything else and go out and live.
Now, there are a lot of people that aren't open to talking, to expressing their emotions, or may get very emotional when discussing something. It may impact them greatly. But art therapy is a great way. Like, getting creative is a great way to sort of put your feelings into something without having to say words.
And it's something that I personally don't work with, but I know that a lot of people feel better about that. There are some people that will do journaling. I just recently had a client that did the writing a letter to the person that had harmed them and then burned it and everything else, just trying to get those feelings out some way. You know, I don't know as many people that like to write, and so I suggest journaling, but I also suggest using the recorder app on your phone, because what happens with anxiety, and a lot of trauma has to do with our anxiety, is that the further we get away from it, the more we want to forget it. And so I'd have somebody come in the office and they said, you know what, I was having really bad nightmares. What was going on at the time? I don't remember, but I remember the nightmares. And so we can talk through things and just record them. We can erase them. We don't necessarily have to share them, but it is a way to get some complicated feelings out in a space where you're more comfortable. For the people that don't like to drive, I tell them, start the recording app when you get in the car, and then just talk to yourself out loud, and hopefully we'll be able to find some things about the feelings that you're having and how you're feeling physically, how the tension is building, and where the problems are and where it starts.
Now, when it comes to helping someone else with trauma, there are some great things that we can do. One of the most important things is be a good listener. What makes a good listener?
Somebody that really has the time, the attention, and the focus to pay attention to what you're saying, that's not going to judge you about it. And that's a really difficult part about abuse, is that there are some people that are going to judge us about that situation, or they're going to snap to judge the abuser and everything else. When we're being traumatized, usually we don't have that kind of control. And it, like I said, it's changed the way we feel about ourselves. We don't want to admit those kinds of things because we felt so powerless. And oftentimes talking about it will make us feel powerless again. And so you have somebody that will pay attention and has focus and won't judge and won't try and fix it. Trauma's not going to be fixed today. Trauma's going to take a while. And so we're looking for some sort of insight and understanding and kind of getting your feet underneath you so you really don't feel the way you did when you came in. You generally don't want to talk to a parent about this. You generally have to choose somebody who's going to be real but understands you. Your mom is always going to tell you that things are going to be okay. They're going to tell you that everything's going to be fine. And things for a while may not be. You need somebody that's going to be realistic with you about it too.
And you touched on it. Find somebody, try not to judge. So throw judgment out the window and really just listen and avoid that, and then respect their privacy and boundaries.
Absolutely.
So as you talked about with the taco story that you were sharing, just figure out if they're not ready to open up or talk, that's a boundary that you were respecting.
And that's a really difficult thing when you're seeking help from family, is that sometimes you can't trust your family to keep your secret. And at least in the beginning, it feels like a really big secret and you don't want to tell anybody. And it's really, really difficult. And so finding a person that you trust to tell that's not going to share it anywhere else can be really problematic. If you talk to one of your siblings and then you find out, oh, they told somebody else, it's really going to clam you up, and it's a really bad experience. And having that betrayal can be a trauma of its own.
Now, what should you do if you feel that someone is unsafe and they're dealing with their traumatic situation? You feel that they're in an unsafe situation. It may be. What's your advice for helping them through that?
The best advice is to have them call South Texas Health System Behavioral. We do free assessments 24/7, and that way, if you're there at 3 in the morning and you don't need to be in the hospital, they'll do a safety plan with you, help you find resources to get help, and so at least then you're sure that somebody's safe. If they do need to be in the hospital, well, they can be admitted. So it's a way of having somebody that's having acute stress to have a quick assessment. And it's 24/7.
And for those people who are struggling and there's that myth that you're going to appear as weak if you open up about your trauma or talk about it, what would you want to tell those individuals? That
really you have put those things away in such a manner that holding all of that energy in has just exhausted you, and it's starting to leak out in some places. And being able to break the seal that you created takes a lot of strength, and to be able to talk about it. You recognize that I'm not in a good place right now. It's the people that don't do anything that are really suffering, and it's time to come back and try and get better. Try to heal.
And as you mentioned, it doesn't have to mean you go seek professional help. You can go to a support group. There are peer support groups. There's pastoral groups that you can go to. There are places that you can turn.
Yes, absolutely. And sometimes just talking to somebody who has a little experience and is willing to listen to you is enough. It depends on the trauma and more what kind of problems the trauma is causing now.
All right. Well, that is all very enlightening information. We appreciate your time, Bob.
Not at all. Thank you so much.
And that officially concludes our webinar. We thank you for joining us. We hope you'll continue to prioritize your mental health and the mental health of your loved ones. If you are experiencing a mental health challenge, STHS Behavioral can help. The facility has served the South Texas community for more than 30 years, offering inpatient and outpatient treatment options. If you or a loved one is experiencing a mental health issue, you can schedule a confidential assessment by calling our hotline at 956-388-1300. Please remember that you are not alone. Speak with a loved one or seek professional help if you need emotional or mental health support. And if you are experiencing a mental health crisis, it's important to call the National Suicide and Crisis Lifeline at 988. Licensed counselors are available to speak with you in English and Spanish 24 hours a day, 7 days a week. Now, don't miss our next installment of this Let's Talk Mental Health series on Thursday, November 6th, broadcast live at 5:30 via Facebook as we discuss surviving suicide. We hope you can join us. And to watch our previous Let's Talk seminars, all you have to do is visit sthsletstalk.com. Until our next webinar, stay healthy, stay safe, and please continue to prioritize your mental well-being. Sometimes life's burdens can take their toll on your emotional well-being. If you or a loved one is struggling, know that you are not alone. South Texas Health System Behavioral can help you cope with depression, manage feelings of anxiety, regain control of mood swings, and recover from substance use disorders. Our staff is available 24/7, offering the quality and compassionate inpatient and outpatient care you need to overcome life's challenges. South Texas Health System Behavioral, where your mental health is our priority.